Hi, I'm Dr. Bill Johnson of Enhanced Medical, and I want to discuss with you exactly why we have introduced the Enhanced BBL and why pre-treating the fat and the buttocks beforehand is such an important factor to make long-term fat survival greater. The dirty little secret about Brazilian butt lifts is in the past, some of the fat has had to die. By dying, what happens is those cells say, help me, and they release chemical messengers called growth factors that stimulates your body's immune system. Your body comes in, sees these fat cells that need help, and builds a new network called typically a scaffolding and new blood vessels that allow the part of the fat that didn't die to survive long term in the transfer area. Once that scaffolding and blood supply is secure, the fat survives as far as we know for the rest of your life. The problem is some of it had to die to stimulate that healing process. Now we have a way of speeding that up and needing many fewer fat cells to die to make it happen. What we are doing is we pre-treat the area being liposuction and the buttocks with a technology called extracorporeal shockwave therapy, or ESWT. It's also known as acoustic wave therapy, or AWT, and you can study more about that on our website if you like. But this acts as a mini shockwave. What that does, though, and it's well shown to cause the release of many of the same growth factors that before we were requiring cells to die to release. In addition, when we use the SWT on the area, the stem cells in that fat are awakened and start getting ready to go to work. Again, rather than having to wait on cells that were transferred to die in order to wake up the stem cells. So by doing the ESWT before the liposuction and before the fat transfer, we are able to activate the fat and make it where much fewer fat has to die with the transfer in order for the cells to get that good scaffolding and that good blood supply and survive long term. You say, why, if both these technologies are old, has it taken so long to put this together? Well, the answer is sometimes in medicine it's hard to connect the dots. 100 years ago, lab technicians were throwing away their bacteria cultures because they got mold on them and the mold would keep the bacteria from growing. It took 15 or 20 years for people to realize that the mold was penicillin and take those same mold structures, make it into penicillin. This saves millions of lives over the years and became the first really working antibiotic. We're doing a similar, although less dramatic thing with the ESWT on the fat. We're able to make it work harder, work faster, and save more of this transferred cells. You can learn more at the website by reading the text below. Please click for consultation or give us a call so we can get you started on your enhanced BBL.